Hello guys, let's start the another topic, the nerves of the arm. It is basically the humerus bone nerves. It has the three nerves. First is the axillary nerve. It is the posterior cord nerve and its origin is the C5 and C6 and forms the quadrangular space. Then second is the musculocutaneous nerve. It is the lateral cord nerve and it's arise from the C5, C6 and C7 and supply the sensation to the lateral side of the forearm and also give the articular branches. Third is the median nerve. It has the two roots. First is the lateral root and second is the median root. Lateral root is arise from the C5, C6 and C7 and forms the lateral cord. Median root is arise from the C8 and T1 and forms the median cord. Then the radial nerve is the posterior cord nerve and it's arise from the C5, C6, C7, C8 and T1 and have both the sensory and the motor fibers. Then last is our ulnar nerve. It's arise from the C8, T1 and the medial cord. Let's start the axillary nerve. As we know, it arises from the C5 and C6. The axillary nerves have the two branch, the anterior branch and the posterior branch, and it also give branch to the shoulder joint. This is our the axillary nerve. As we know, it have the anterior branch and the posterior branch. The anterior branch give the branch to the deltoid and some cutaneous branches, and the posterior branch is also give branch to the deltoid muscle and have the cutaneous nerves of the forearm. The axillary nerve leaves the axilla and forms the quadrangular space superiorly have by the teres minor, inferiorly by the teres major, medially by the long head of the tricep, laterally by the surgical neck of the humerus. This is the superior part, it's by the teres minor, inferior by the teres major, medial by the long head of the triceps, and lateral by the humerus. After passing through the quadrangular space, the axillary nerve divides into the two parts, the anterior branch and the posterior branch. The anterior branch around the posterior aspect of the surgical neck of the humerus. This branch supplies the deltoid muscle and also give a few small cutaneous branches. Posterior branch, it supplies the teres minor and posterior part of the deltoid and continue as the superior lateral cutaneous nerves of the arm. This is the diagram of the each arm where it is arises from and which cords. Ulnar nerve, median nerve, radial nerve, axillary nerve and the musculocutaneous nerve and their roots. Then the musculocutaneous nerves. As we know, the musculocutaneous nerves is arise from the C5, C6 and the C7. It came with the axillary artery and give branch to the coracobranchialis and the branchialis and also the bicep branchialis. It's arise from the lateral cord and its roots is the C5, C6 and C7 and follow the cords of the axillary artery. It emerges at the inferior border of the pectoralis minor muscle and presses the coracobranchialis muscle to run between the branchialis and the bicep brachii muscle. Just proximal to the elbow, the presses the deep fascia and laterally to the tendons of the bicep branchialis and continue at the lateral interbranchial cutaneous nerve. Then the ulnar nerve. Ulnar nerve arises from the C8 and the T1. It came with the branchial artery. It arises from the medial cord and run distally along with the medial side of the branchial artery. It presses the medial intermuscular septum to enter the posterior compartment of the arm and runs it downward to the back of the medial epicondyle and accompanied by the superior ulnar collateral artery. The ulnar nerve does not leave any branch in the axilla and in the arms of the nerve. Then the radial nerve. Radial nerves arises from all the roots and its give branch to the long head of the tricep branchialis, also some cutaneous branches, and it's come with the branchially artery. And it arises from the posterior cord of the branchialic plexus and it's from the triangular space laterally by the medial margin of the forearm, by the lower margin of the teres major, inferiorly by the lateral margin of the long head of the tricep branchii. It descends into the back side of the humerus and passing the laterally intermuscular septum. It gives branches to the long head of the tricep branchii, lateral head of the tricep branchii, and the medial head of the tricep branchii. Also the ancunus. The two sensory branches will appear the triceps and the inner way of the skin, the posterior part of the arm and the forearm respectively. It runs along with the profunda of the branchial artery and then the radial nerve descends between the branchialis and the branchioradialis muscle and give branch to the branchioradialis muscle and a small lateral part of the branchials and the extension of the carpia radialis longus. Then the median nerve, it also arises from all the roots and it goes with the axillary artery. Then it arises from the lateral side of the axillary artery, then the branchially artery and crosses in the front of the artery from the lateral to the medial. In the cubital fossa, the median nerves arises the middle of the branchially artery and the tendon of the bicep branchially also cover the basipital epidermis. This is the nerves of our the humerus bone. I will provide the notes in my Telegram channel.